Okay, so let's start about JEMScN 2026 nursing mock test. Okay, so part A, number 1, anatomy and physiology. The circle of Willis is a critical arterial circle located at the base of the option A, heart, B, liver, C, brain, and D, kidney. So the correct answer is the brain. Next, number 2, anatomy and physiology. What is the primary function of bile produced by the liver? Options A, digestion of proteins, B, emulsification of fats, C, absorption of carbohydrates, D, neutralization of stomach acid. So the B, emulsification of fats is correct. Next, number 3, sociology. The feeling of disorientation experienced by someone who is suddenly subjected to an unfamiliar culture is known as options A, ethnocentrism, B, cultural lag, C, culture shock, D, assimilation. So the C, culture shock is correct answer. Next, 4, psychology. The mental discomfort experienced by a person who holds two or more contraindicatory beliefs or values is called option A, cognitive dissonance, option B, confirmation bias, C, groupthink, and D, Stockholm syndrome. So the correct answer is the cognitive dissonance, option A. Next, 5, microbiology. Bacterial spores are highly resistant to heat and disinfectants due to their thick protective coat made of options A, lipopolysaccharide, option B, peptidoglycan, C, keratin like protein, and D, chitin. So the option C, keratin like protein is correct. 6, pathology. What is the key difference between ischemia and infarction? A, ischemia is cell death, infarction is reduced blood flow. B, ischemia is reduced blood flow, infarction is cell death. C, ischemia is caused by infection, infarction is caused by trauma. D, there is no difference. So the correct answer is the B. Ischemia is reduced blood flow and infarction is cell death. Next, 7, pharmacology. Proton pump inhibitors, example omeprazole, work by option A, neutralizing existing stomach acid, B, blocking histamine receptors in the stomach, C, suppressing the secretion of gastric acid, and D, creating a protective layer over the stomach lining. So the C is correct. 8, genetics. Turner syndrome 45X0 is a chromosomal disorder that affects option A, males only, B, females only, C, both females and males, and D, primarily males but can affect females. So the correct answer is the females only. 9, administration. The formal line of authority and communication in an organization from top to bottom is known as the option A, span of control, B, chain of command, C, unity of direction, and D, decentralization. So the B, chain of command is correct. Next, 10, education. According to Bloom's taxonomy, the highest level of cognitive skill is A, analyzing, B, evaluating, C, applying, and D, creating. So the correct answer is the D, creating. Next, 11, research and statistics. Which type of research primarily deals with numerical data and statistical analysis? Option A, qualitative research, B, quantitative research, C, historical research, and D, case study research. So the correct answer is the B, quantitative research. 12. Anatomy and physiology. What substance produced by type 2 alveolar cells reduces surface tension in the alveoli to prevent their collapse? Option A mucus, B surfactant, C pleural fluid, and D hemoglobin. So the B surfactant is correct. 13. Microbiology. In the transmission of malaria, the mosquito acts as a option A pathogen, B reservoir, C vector, and D fomite. So the correct answer is the C vector. 14. Pharmacology. The ratio between the toxic dose and the therapeutic dose of a drug is known as the A. Half-life, B. Bioavailability, C. Therapeutic index, and D. Potency. So the C. Therapeutic index is correct answer. Psychology. An intense irrational fear of a specific object or situation is defined as option A obsession, B compulsion, C anxiety, and D phobia. So the correct answer is the B, D phobia. 16. Pathology. Gout is a form of arthritis caused by the deposition of which type of crystals in the joints? A. Calcium oxalate, B. Struvite, C. Uric acid, and D. Cholesterol. So the correct answer is the C. Uric acid. 17. Genetics. What was the main goal of the Human Genome Project? Option A to clone a human being, B to cure all genetic diseases, C to map and sequence all the genes of a human, and D to create genetically modified organism. So the correct answer is the C to map and sequence all the genes of a human. 18. Administration. Which of the following is a primary purpose of an incident report? Option A to punish the staff involved, B to document facts for quality improvement, C to inform the patient's family of an error, and D to be placed in the employee's permanent file. So the B is correct. 19. Education. An assessment conducted during the learning process to provide feedback is known as A. Summative assessment, B. Formative assessment, C. Diagnostic assessment, and D. Standardized testing. So the B is correct. Next, 20. Research and statistics. The ethical principle that requires researchers to ensure participants understand the study and voluntarily agree to participate is option A beneficence, option B justice, option C confidentiality, and D informed consent. So the correct answer is the D. Next, part B, 21. Foundation of nursing. To measure the correct length of nasogastric tube insertion, the nurse should measure from the tip of the nose to the earlobe and then to the option A clavicle, B manubrium, C umbilicus, and D the xiphoid process. So the correct answer is the xiphoid process. 22. Foundation of nursing. The Braden scale is used to assess a patient's risk for option A falling, B developing pressure ulcer, C malnutrition, and D infection. So the correct answer is the B. 23. Medical surgical nursing. Cushing triad, a late sign of increased intracranial pressure, consists of hypertension, bradycardia, and option A trachypnea, option B regular respiration, C fever, and D hypotension. So the correct answer is the B. 24. Medical surgical nursing. What is the priority nursing assessment for a patient with a new limb cast? Option A checking for foul odor, B assessing circulation, sensation, and movement, C asking about pain level, and D ensuring the cast is dry. So the correct answer is the B. Next, 25. Pediatric nursing. A key sign of moderate to severe dehydration in an infant is a option A bulging fontanelle, B sunken fontanelle, C increased tearing, and D moist mucous membrane. So the correct answer is the B sunken fontanelle. Next, 26. Pediatric nursing. Tetralogy of Fallot is a congenital heart defect. Which of the following is not one of its four characteristics? Options are A. Ventricular septal defect VSD, B. Pulmonary stenosis, C. Overriding aorta, and D. Atrial septal defect. Correct answer is the atrial septal defect ASD. Psychiatric nursing. 27. Tardive dyskinesia, characterized by involuntary movements of the face and jaw, is a potential side effect of long-term use of which medication class? A. Antidepressants, B. Antipsychotics, C. Mood stabilizer, and D. Anxiolytics. So the correct answer is the antipsychotics, option B. 28. Psychiatric nursing, a therapeutic communication technique where the nurse repeats the main message the patient has expressed, is called option A. Reflecting, B. Clarifying, C. Summarizing, and D. Focusing. Correct answer is the reflecting, option A. 29. Obstetrical nursing. What is the correct sequence for the stages of lochia after delivery? Option A. Alba serosa rubra, B. Serosa rubra alba, C. Rubra serosa alba, and D. Rubra alba serosa. So the correct answer is the C. Rubra serosa alba. 30. Obstetrical nursing. The priority management for a patient experiencing an eclamptic seizure is to option A. Administer an antihypertensive, B. Prepare for immediate delivery, C. Ensure a patent airway and patient safety, and D. Insert an IV line. So the correct answer is the C. Ensure a patent airway and patient safety. 31. Community health nursing. The epidemiological triad of disease causation refers to the interaction between option A. Agent, host, and environment, B. Pathogen, vector, and climate, C. Person, place, and time, and D. Bacteria, virus, and fungus. So the correct answer is the option A. Agent, host, and environment. Next, 32. Community health nursing. The Under 5 clinic provides a package of services that includes growth monitoring, immunization, and option A. Geriatric care, B. Surgical services, C. Health education, and D. Advanced diagnostic. So the C. Health education is correct. 33. Medical surgical nursing. A patient with angina pectoris is advised to take nitroglycerin. What is the most common route for immediate relief? Option A. Oral, B. Transdermal, C. And intravenous, and D. Sublingual. So the correct is sublingual. 34. Obstetrical nursing. What is the primary purpose of performing an amniocentesis during the second trimester? Option A. To determine the sex of the fetus, B. To assess for fetal lung maturity, C. To detect chromosomal abnormalities, and D. To treat polyhydramnios. So the correct answer is the C. To detect chromosomal abnormalities. 35. Pediatric nursing. Phototherapy is a common treatment for physiological jaundice in newborns. It works by option A. Increasing the infant's vitamin D levels, B. Breaking down bilirubin in the skin, C. Improving liver function, and D. Stimulating red blood cell production. So the correct answer is the B. Breaking down bilirubin in the skin. 36. Psychiatric nursing. In a therapeutic relationship, when a patient unconsciously transfers feelings about a person from their past onto the nurse, it is known as option A. Counter transference, option B. Transference, option C. Projection, and D. Resistance. So the correct answer is the transference. Transference is correct. 37. Community health nursing. The National Vector-Borne Disease Control Program (NVBDCP) in India addresses all of the following diseases except option A malaria, option B dengue, C tuberculosis, and D filariasis. So the correct answer is the tuberculosis. 38. Foundation of nursing. Which type of isolation precaution is required for a patient with pulmonary tuberculosis? Option A contact precautions, B droplet precautions, C airborne precautions, and D standard precautions. So the correct answer is the C airborne precautions. 39. Medical surgical nursing. A key feature of diabetic ketoacidosis is the presence of option A hypoglycemia, B metabolic alkalosis, C ketones in the urine and blood, and D low serum potassium. So the correct answer is the C ketones in the urine and blood. 40. Obstetrical nursing. The postpartum process by which the uterus returns to its non-pregnant state is called A. Involution, B. Subinvolution, C. Lochia, and D. Effacement. So the correct answer is the involution. 41. Pediatric nursing. By what age should an infant typically be able to sit without support? Option A 2 to 3 months, B 4 to 5 months, C 6 to 8 months, and D 10 to 12 months. So the correct answer is C 6 to 8 months. 42. Psychiatric nursing. What is the highest priority when assessing a patient with suicidal ideation? Option A their recent life stressors, B their family history of mental illness, C their specific plan and intent, D their history of past attempts. So the correct answer is the C their specific plan and intent. Community health nursing. In India's healthcare system, the auxiliary nurse midwife is primarily posted at the option A district hospital, B community health center, C primary health center, and D sub center. So the correct answer is the D sub center. 44. Foundation of nursing. A fever pattern in which the temperature remains above normal throughout the day and fluctuates more than 1 degree centigrade is known as option A intermittent fever, B remnant fever, C sustained fever, and D relapsing fever. So the correct answer is the remnant fever. 45. Medical surgical nursing. When providing care for a patient with an ileostomy, the nurse should expect the stool to be option A solid and formed, B soft and semi-formed, C liquid to semi-solid, and D hard and pellet-like. So the correct answer is the C. 46. Obstetrical nursing. In managing a delivery with shoulder dystocia, the MC Roberts maneuver, Mac Roberts maneuver involves option A applying fundal pressure, B rotating the baby's shoulders, C sharp flexion of the maternal hips, and D making an episiotomy. So the correct answer is the C sharp flexion of maternal hips. 47. Pediatric nursing. A nurse is caring for a child with a diagnosed Williams tumor. Which nursing intervention is crucial? Option A administering chemotherapy, B monitoring for hypertension, C avoiding palpation of the abdomen, and D encouraging high fluid intake. So the correct answer is C avoiding palpation of the abdomen. 48. Psychiatric nursing. Which intervention is most appropriate for a patient experiencing a manic episode? Option A encouraging participation in a large group activity, B providing a quiet low stimulus environment, C engaging in a lengthy psychoanalytic discussion, and D allowing the patient to lead all activities. So the correct answer is the B. Next, 49. Community health nursing. The primary function of a primary health center in India is to provide option A, specialized surgical care, B, comprehensive primary health care, C, medical education and research, and D, tertiary level referral services. So the correct answer is the B, comprehensive primary health care. Next, 50. Foundation of nursing. Which of the following should be included in an incident report? Option A, the nurse's opinion of the cause, B, a factual objective description of the event, C, suggestion for disciplinary action, and D, other patients' names as witnesses. So the correct answer is the B, a factual objective description of the event.